the laws actually prohibit any counseling, verbally, just talking with someone who, not just on sexual orientation issues, but who has gender confusion. So if you have a young man who is really confused about his gender and behavioral issues, so feels compelled to dress up as a girl but doesn't like it and is troubled, if your licensed counselor tries to help him inconsistent with his own religious and moral beliefs to say, well, you don't have to do that, that is now, you'll lose your licensure in New Jersey and Washington, D.C., and California. In other states, it has stopped. So I think, and if you actually look at the underlying science on that, which I give citations, this is preposterous. Look, I'm not an expert in this area, but I've done enough research. Sexual orientation is a hard issue, and I don't presume to pretend whether any person can necessarily change their orientation or not. I will say the evidence out there from the study of the mass survey of youths at risk and some other studies is providing pretty clear and convincing evidence that sexual orientation and attraction identity are quite fluid, especially for young people. And so, something like 80% of males who, as of 14 or 15, identified, say, with same-sex orientation primarily within 2 or 3 years, almost all of them have, self-identify as heterosexual. This has gotten, the survey, the research has gotten so clear on some of this that even some in the LGBTQ community, I can't always remember all of the numbers on there, Lisa Diamond from University of Utah, self-identified lesbian, not at all, doesn't support anything of, say, people who don't support same-sex marriage, so she's completely against that. But she gave a lecture I actually quote. And actually, I'll just quote her comment because it's just really revealing. She warns that they need to drop this idea that sexual orientation as a talking point is absolutely unchangeable because her research shows the opposite. And as she puts it quite, and I'm quoting her, so, quote, "The queers have to stop saying, please help us, we're born this way and we can't change." And she goes on to say they have to stop doing that because it's going to bite us in the ass because now we know there's enough data out there showing it's not true. So I think this is classic, misuse of science to basically, in this case, to hurt young people from getting help that they want. In most states, by your age of 13, you have the choice of medical treatment that you want, can't be forced to have that you don't want. And so the only people these laws that Chris Christie signed in New Jersey are going to hurt are actually already has. In New Jersey, there was a Catholic teenager who was subject to suicide and some other things, and his parents got him with a licensed counselor who helped him. He didn't like some of the feelings he was having and helped him, but then when the law was passed, they no longer can have him see a licensed therapist that can counsel him according to his own values in New Jersey. So this impacts real people.